Mississippi Governor Tate Reeves says he has the prescription for ailing hospitals across the state. Basically, he's going to max out the state's Medicaid reimbursement rates. It's a two-pronged approach that starts with what's called the Mississippi Hospital Access Progrm. That program will grow from $562 million to more than $1.5 billion next year.
We'll provide payments to hospitals serving patients in the Mississippi Medicaid managed care delivery system. With these payments, hospitals will be reimbursed on a higher level than before.
MHAP affects people in so-called managed care systems. Reeves' increase would bring the program up to what's called the average commercial rate. Next, Reeves wants to put more money into the so-called fee-for-service system and max that out to the federal limit. He's talking about $137 million there for next year. What kind of impact will that have across the state?
What we are doing today will result in a new investment of about $700 million for our hospitals.
More important than that, what impact will this have in the Delta?
An over $15 million or 259% increase for Delta Regional Medical Center. Approximately $10 million or 138% increase for Greenwood LaFleur Hospital.
Bolivar Regional will get about $9 million more, a boost of about 208%. Reeves says rather than expand Medicaid rolls, what he calls putting more people on welfare, with more Mississippians working these days, he wants to get more people into private insurance programs, which pay hospitals more than Medicaid. He boasts that all this comes at no cost to taxpayers. But that's not exactly true. You see, this program is funded by a hospital tax, and that money comes from people who use hospitals.
But in terms of direct payments, that will be coming from the hospitals themselves. Ultimately, those who receive care through these particular institutions are going to bear some of that cost.
Now, all this needs the approval of the Centers for Medicare and Medicaid Services, and apparently nobody sees any problem with that. By the way, there's no telling right now if that money would help keep Greenwood LaFleur Hospital open, though it seems safe to say everyone here hopes it does. Dennis Turner, the Delta News.